Welcome to the latest episode of Healthcare AI. I'm Todd Schlesinger, and once again excited to be your host for today's show. AI is changing patient expectations and the experience of healthcare. What does this change mean for the way we do healthcare? And what do providers need to think about as AI reaches an inflection point in the industry? To help us answer these questions, we're delighted to have Jeffery Fuller, the Executive Director of Analytical Solutions for the UNC Health Care System, on today's show. Welcome, Jeff.
Yeah, thanks, Todd. It's a pleasure to be here.
Jeff, I really want to kick things off and get your thoughts on really why is patient engagement and consumerism such a focus right now?
I'm glad to take some time to talk about this topic. It's, for me, a really important one. It's not what I do in my day job, but I do believe that we're in a really interesting time in our industry. It's a great moment where I think a lot of the incentives that drive our economic model for healthcare delivery are aligning in a way that really caters to the patient's needs. So one thing I like to kind of think about is just the consumer industry in general and patients at the center of it. Patients today are, at the end of the day, they're trying to find the best fit for their overall health needs. And one way to do that is to have a provider that's flexible, responsive to those needs. And up until this point, really, the separation between that consumer experience and then who the customer is, who's actually paying the bill, has been separated by, frankly, some perverse economic incentives to not really take the patient and put them as a part of the decision-making process in that. So for me personally, I've been in healthcare for over 20 years. I think this is a really exciting time where we've got an opportunity to join with the patient, make them part of the care team, and really evolve the practice of medicine to something new and exciting.
Yeah. So to that point, how is the role of the patient changing in this new kind of evolution?
Yeah, sure. So I think if you look at health reform in general, there's definitely a sense that there's fear for patients and things that go beyond just their health. They're worried about paying their bills. They're not involved in the decision-making process. They feel, in some ways, like the hospital is a transaction that has to happen when we're sick. We need to evolve that to really make the patient part of that process. We're all familiar with the value equation, and as providers, it's really important that we're always looking for ways to provide the most efficient care at the best outcomes. But if you really ask the patient, well, what's important to you? What are the outcomes that drive you to want to make better, healthy decisions? Then you kind of think about, well, what's the healthy life that I want to live? And as healthcare providers, I think we're obligated to really figure out, well, what is the fair price and mix of services that you need in order to live that healthy life? And I think if we all become more accountable in that kind of way, then the experience for the patient is going to really drive those steps that are needed to kind of evolve to a place where what we're measuring is really what matters to the patient. Yep. The definition of value can really kind of drive how we measure the success economically of the healthcare ecosystem. And there's a lot of different, I think, opportunities for technology and how we use the plethora of data to really drive that forward.
Yep.
And so I think it's patients should really know that healthcare industry in general are closing the gap between all the different third parties that are involved in that ecosystem in really unique and creative ways.
So, Jeff, you mentioned data, you mentioned technology. How is AI really redefining the consumer health experience?
Yeah, well, it's a good question, and it's a tough one. I think when we're trying to cater to the public perception of trust in the healthcare delivery system, we're constantly in a defense mode for trust these days, just with the rising cost of healthcare, and I think it adds to it when you kind of think about this misinterpretation of what AI is, and are the doctors going to take over or the robots going to take over for the doctors, and that kind of thing. So I think it's important to point out that AI is extremely early in our industry, and it's not intended to do the kinds of things it does in other industries. I think if we really think about value-based care and how to augment decision-making where computing power can do more than the human brain can do, then it becomes a way to just add efficiency and bring real value to that patient-physician interaction. If you use it carefully, if you have what I call explainable AI, where it's not just prompting you to do something or think about something that you might not be considering, but it explains why this is important, gives you some leading indicators so that interaction can just become more deep with the patient. So, for instance, if you're thinking about care management and we're trying to address some of the community and social needs of the patients, you're going to be prompted through particularly some sort of prescriptive way to say that, maybe this patient is suffering from some sort of disorder where a social worker could step in and help. These are really positive ways to think about AI, just augmenting that decision-making process between the clinician and the patients. But again, it's very early on, but I do think we're in a great moment in our industry to be able to take advantage of some of this. And more importantly, I think that as I said before, the connection between the consumer and the customer kind of going away. So the consumer is really looking for a different experience with their healthcare.
Yep.
They want to be in a position where they're getting convenience. There's personalized care that takes advantage of things like their reported outcomes and experiences in their community and their homes that can really take advantage of what AI can bring to a patient, physician, or clinician interaction.
Sure. So not about necessarily taking over for the physicians, but providing them meaningful insights that then they can use to help improve on care. Absolutely makes sense. So what does this mean for the provider, do you think?
Sure. So as a health system, so the UNC Health Care System, we're a large organization. We're like many across the country where we have 11 or 12 hospital locations and then thousands of physicians collaborating in new ways through a clinically integrated network. Mm-hmm. We're partnering with our payers in new and unique ways than ever before, where we're not talking about negotiating for really transactions of care. We're recognizing the overall trends in our own market, but across the country, where the role of the hospital is changing and evolving. So hospitals are shrinking in size, and chronic conditions are on the rise for different reasons than before. And so we're in a position where we have to meet the patient where they're at. Physicians and care teams have to design themselves around a model that really takes advantage of a lot of different technologies, not just AI, but thinking about community resources, bringing telehealth and virtual medicine to the forefront, and just really thinking about how to do that in a way that's going to create a competitive advantage. Because frankly, we as a health system are competing for the patients whose dollars are at stake now with high deductible health plans and more risk contracts between us and our providers, our payers, and their willingness to kind of try new on-demand access to care, then we're put in a position to just think about the practice of medicine differently.
Sure.
So I'm not a clinician, but I support and advise our clinicians on a regular basis on how to do this effectively. And it really just gets down to I think the American Hospital Association stated that care models really need to be centered around being preventative, personalized, and participatory. And those three Ps for me are really what it's all about. And it's just a different interaction between providers and patients. That participatory piece of it is particularly interesting because we have new ways to share data amongst each other. This question of portable health data, whether it's patient-reported outcomes or whether it's devices, or it could even be claims interactions across the continuum of care, where we're not always the provider, but there's new and unique ways to make that data interoperable and usable in models that we can prompt for care management concerns.
Can you expand on a couple examples on really how these AI technologies are changing the way patients interact with their caregivers? You touched on a few of them. Can you expand on any of them?
Yeah, sure. So just keeping in mind that I use AI probably a bit more broadly than maybe the textbook definition of it. Again, I think where computing power can augment clinical decision making, that to me falls into the overall umbrella of AI. And if we're thinking of it in those terms, then we have a number of just real kind of interesting but very novel solutions in just how we establish programs to care for our patients. One example would be just using some historical data on our patient population that's kind of already stratified for the common risk factors that exist for patients. What registries they belong to, and their age, and those and their past history of hospitalizations. We can kind of take a look at those patients that require intensive care management and establish programs that are unique to them. That take into consideration markers from things like lab results and pharmaceutical adherence and those sorts of things. So a good example would be like we have a program we call a tuck-in call. Our care managers have a list of patients that are driven by a number of different historical indicators, markers about the patient that would prompt them to just highlight the best patients to call, say on a Thursday afternoon, that are at the most risk for having something come up that leads to a potential ED visit over the weekend. So we call it the tuck-in call because it's kind of tucking you in for the weekend, make sure you're okay, make sure you have access to, the care that you need, the food you need, that you're taking your medication, so on and so forth. So it's a very simple way. It's AI in the sense that we're taking experience of a large data set that it would take. You wouldn't be able to compute on your own, and boiling it down to I need to call Mrs. Jones on Thursday afternoon because she will miss her appointment next week, and we don't know if she has a ride to that appointment, or she's not taking her medication, or she doesn't have access to healthy food, those sorts of things.
Sure. Well, so that's great. I mean, talking about the patient, but now let's shift to what do providers need to do to adjust to these new expectations from the patient?
Yeah, so it's a great question. I think that the provider's mindset needs to just recognize that the state of the industry and really the unaffordability of care that exists, and the reason why these novel solutions around value care and using technology and data to do better patient-centered care is that the patients are choosing to avoid necessary care. So we talk a lot about trying to avoid unnecessary care to improve value, but patients are at risk for a number of different things. Their fear to be able to pay their bill, their inability to cover their deductible, them just not being insured. And when we look at our current day public health crisis, it's a completely different situation than before. We actually, there's some data out that shows that our mortality rate's increasing at a rate higher than it ever has since the Spanish flu after World War I in 1918. Oh, wow. And that it's not cardiac disease that's driving it. It's a public health crisis around what you might call afflictions of despair, things around opioid abuse and suicide and depression. So this sense of security that the public wants and needs from their healthcare provider takes on a different shape and a different form. So I can't stress enough that when we talk about moving medicine from acute care to chronic care, it has to redesign the whole setting of the ambulatory office, encouraging practices to think about mental health, social determinants of health, and just all those needs need to become easier to understand and at the forefront of how we design our care models. And a lot of it takes innovation, and I use the word innovation a lot here, and it's another one of those buzzwords that I have to clarify. And innovation is not necessarily cutting edge or creative. It's just simply doing things differently that completes the job in a way that wasn't getting completed before.
Do you think that we'll get there to a place where the providers feel that they are gaining a benefit from technologies like AI?
Yeah, I think we are. I mean, the clinicians and care teams that I interact with are asking for this to frankly move a little bit quicker.
Hmm. Yeah,
That they recognize they're the ones that are on the phone making 50 phone calls a day, and they're recognizing that just through those interactions, they're collecting sentiments about their patient's experience that are not collected anywhere, and it's not something that's being prompted to them. So they want to be able to deliver care that is a far more better and convenient experience for their patients. And I don't think it's a huge leap for us to show how data and technology can help achieve that, or at least augment the process it takes to get to that point.
well, that's refreshing to hear your take on that. But why do you think, I guess, healthcare has been resistant to these innovations, these AI technologies, really up until this point?
Yeah, well, I think part of it is just investing in it. So
Hmm.
health delivery and in general has invested in data and analytics and those types of solutions, but not at the degree that I believe it's needed to really understand that this this is a part of the improvement process of the revolution of healthcare delivery. So when we interact with clinicians and we're trying to ideate on what analytical solution can fill a gap, we certainly don't start with saying we're here as a support function.
Hmm.
We very much position ourselves as saying we're really a strategic partner, a business function that is at the front line along with you. We want to stand alongside the clinicians and what I call just fall in love with the problem together. The solution will
That's
come
great.
through a collaboration of clinical expertise and the data science that's needed to produce a better capabilities to do this going forward. So I think it's just a shift in mindset that part of the care team can involve these tools and solutions as
Hmm.
much as the patient needs to and strives to be a part of the care team. I believe that the technology needs to be seen as an equal member of the care team, and that's starting to happen more and more, especially as we think about what people are showing up with. They're equipped with more information than ever before. I mean,
Sure.
the patients engaged in their own care, frankly, through Dr. Google more than anything else, and that's not necessarily the best way to approach the healthcare change that needs to happen. We really need to personalize the experience for the patients by involving these different elements of understanding what health looks like to the individual
Hmm.
and their given life situation, their community situation, and take advantage of the growing amount of data that tells us about how those things exist out there and we're not aware of them. And so we get proactive in reaching out to those patients that need this care more often.
So would you go as far as saying that we've reached an inflection point here in the industry with AI technologies? Or if not, are we
Unfortunately,
almost there?
yeah. Unfortunately, no. I don't think we're there. I am I'm an eternal optimist. I've been doing this a long time, and I feel that the ingredients are there that are needed to be a lot clearer on how we can get to that. But we have a long way to go. I mean, there's certainly great examples out there, but I think that it's got to be done in partnership with all the players in the health ecosystem. It's
Hmm.
not going to be any one shop in a health system like mine. Like we're open to learning from across our network of health systems our size, and we've done a lot more of that collaborating and talking. So I think we as an industry need to work together more to learn from each other, and that we just need to be open to new and unique partnerships because disruption from within is possible, but you got to do it now, especially with the amount of capital going into
Sure.
the Amazons and the Googles and CVS and so forth.
So what's the next big step for consumerism and AI then? How do we get to that next point?
Yeah, so for us at UNC, it's about trust. It's just recognizing that we as a state, really in North Carolina, there's a lot of change happening in how on-demand access to care is happening. And we have to do a couple of things. We have to make sure that the patients know that we are them. This is our state hospital system,
Yep.
and we need to regain their trust that we are not just the big scary hospital on the hill. We are in your communities. We are doing unique things with home health and virtual care to really connect with you where you are at, you and your families, and that we're working diligently to create an experience that helps you feel like we are a partner in improving the healthy life that you want to live. And so that's the first aspect of it. And then the second aspect of it is that we just have to organize ourselves to that end. Traditional health delivery systems have operated in silos where the people working with the payers and the people working with the data and the people working with the pharmacy and so on and so forth, they're just in different areas. So we create a whole lot more collaborative experiences where those improvements can be on the table, and we work together regardless of what group you belong to. We're starting to work together in more and unique ways. So it's the people aspect of it. If you think about people, process, and technology,
Yep.
I think you gotta. I always
Bring
say the
them all
math is
together.
the easy part.
Yeah.
The math is the easy part. You got to have the people in the process ready to adopt and mature the math for it to be successful. So we focus a lot on what does this mean for the patient, how do we work together, and what is the culture of change in our organization, and how can we really be there for our state as, frankly, there's just a lot of distraction to who should I trust in
Sure.
bringing health to my life.
Well, as we move to that kind of culture of change, what do you see as some of the risks that we may run into?
Yeah. Well, I think that the financial incentives are at risk here. I mean, we're at unsustainable levels of cost, and big things will have to change for us to thrive as an industry. And I think everybody is aware of that, but just it kind of just elicits this feeling of uneasiness, and then you just kind of try to forget about it. But the reality is we're operating like a public utility in many ways. Half of our revenue today comes from the government. We're in a political cycle where healthcare is always on the chopping block, and I think we need to prepare for the fact that the majority of Americans are okay with some version of Medicare for all. So if we look at where we are as an industry, I think we just have to recognize how we're spending our operating dollars, and that goes for the payers and the providers. And we need to focus it more on what benefits the patient. We have a lot of spend on administrative overhead that frankly is funding the fee-for-service industry. And so how can we redirect those dollars to be more cutting edge and innovative that benefits the patient directly? So just get our discretionary funds directed at helping the patients and families feel safe and that they can trust their healthcare system. Otherwise, we're going to be at risk of disruptors coming into the market and trying to replicate our product as a healthcare system, but wrapping it with a trusted brand.
Yeah.
I joke sometimes. It's like, well, do you want to get your healthcare from the same place where you get your laundry detergent, or the place where we're
Right.
really cutting edge and trying to solve really big health crisis problems?
So look into your crystal ball for me. The next 12 months of consumerism. What does it look like?
Well, I think the patient's going to have a choice. I think that the funding model is going to become more simplified. I think that through price transparency, so if providers' negotiated rates are made public, there's going to be a lot of mining and normalizing as a result of that.
Sure.
Data being out there. I think price caps are a real thing that we should prepare for, that the government will regulate some version of price cap. So with that kind of off the table, in other words, we're not as much in control of our economic health as before. then we have to focus on competition. And that competition means that if other industries have figured out how to be flexible and responsive to patient needs, then the health system needs to be there first in a lot of ways, because it's going to become their choice. If they want to engage with the trusted name and brand of the state health system like ours, then we have to be able to serve them in a way that meets their expectations, frankly. And we're very good at focusing on quality, so I don't worry about that. I don't worry about a lot of the things that have sustained us over such a long period of time. But I think that the on-demand access, that first level of entry, where your front door is to the health ecosystem, is up for grabs, frankly, with competition. So we just need to focus on being trusted as the brand for doing that, and we do it through programs that involve technology, for sure.
Well, will AI become a competitive advantage?
Well, I'm not sure that it will to the patients. I think that it certainly will in the next year for how our outcomes and our quality and cost of care that we achieve are gained. So I think that it's a long ways from the customer's perspective to see it as anything other than science fiction, but that we as a health industry certainly are poised to use that to make patient decisions that are going to improve our value.
Awesome. Well, Jeff, I can't thank you enough for taking the time to speak with me this morning. I really enjoyed our conversation, but thank you very much for your time.
Yeah, thanks, Todd. It's my pleasure.
Thanks so much to our guest, Jeff Fuller, and thank you for listening to Healthcare AI with me, Todd Schlesinger. If you like our show and want to learn more, please check us out at jvion.com and look for us in the coming months on iTunes or wherever you get your podcasts.